facing a challenge. Ideally, 3 documents. Have a policy statement, one side of A4, that basically sets out your stall, that says this is what's acceptable and this is what's not acceptable. Then have a policy document and a procedures document. The policy gives all employees the knowledge of what's expected, what's not expected, where to get help, how to get help, etc., etc., etc. And the procedures document is there to enable the key stakeholders, the HR staff, the health and safety staff, the directors, the people who are needing to make decisions when to test, how to test, what to do in a negative result, what to do with a non-negative result, and what to do with a positive result, etc., etc. These policies and procedures should be written by experts. Quite often we see policies and procedures written by a legal department or a solicitor. And believe it or not, because they don't have the specialist knowledge, they often leave a lot of things out of the policy. So, in summary, policy and procedures should be easy to follow, clear, detailed, robust, and legally defensible. Get them written by experts, not just a copy and paste. Following on from that, training and education is key. So if you think about policy and procedures, if you were building a house, that's your foundation. The training and education now is the brickwork. So training and education needs to be delivered by people with knowledge. It needs to help your staff meet all their obligations and your company to meet your obligations under health and safety legislation and local law. So your country, your county, your industry may have obligations under health and safety law that you must meet. And to ask your staff to meet those, you need to be able to educate them or train them accordingly. What that does is ensures responsible and consistent action. If you deliver education and you allow people to understand what you're doing, and you deliver training, and those two things are two separate things. Education is providing knowledge. Training is to equip the people with the correct knowledge and tools to be able to take action, and to ensure that they take responsible and consistent action. Everybody's singing off the same hymn sheet. Everybody's following the same guidelines, the same procedures. So you have one staff member always deals with somebody exactly the same as another staff member would be. What it also does is give your managers, supervisors, and directors and departments the confidence to be able to follow the policy and procedures as they're written. It gives them the ability to be able to spot signs and symptoms. It gives them the ability to follow what we call a chain of custody. Being able to trace back exactly from start to finish what's happened. Did you spot the signs and symptoms? Yes, I did. What were they? What did you do? Did you call a test? What was the result of the test? Was the test done in a legally defensible manner? From start to finish. Chain of custody starts from the very beginning. Get yourselves qualified trainers. So again, where we're talking about experts writing the policy and procedures, get experts to deliver the training. Always allow correct time. We get asked quite often, oh, could you do as an hour's training? And can you cover all these things? And the answer is no, we can't cover them in detail in an appropriate manner to ensure responsible and consistent action. So allow a correct amount of time, but also allow a budget. Good trainers cost money. It's as simple as that. But they'll deliver quality and consistent training time after time after time. What you'll get is employee engagement. Ensure you roll out education to your employees and not propaganda. Propaganda doesn't work. We've all seen it. Just say no. That doesn't stop anybody taking drugs. What you need to do is give people the knowledge and the education for them to take responsible decisions. Everybody has choices. So give people a reason to make responsible choices within your workplace. A couple of things that you might see on training. So when you talk about signs and symptoms, the eyes are the windows to the soul. So you may be taught to look at the eyes, have a look at the size of the pupils, have a look at are they constricted, are they dilated, etc., etc. But this is one of the things that would be covered on a signs and symptoms course. So this is not an exhaustive list, but what can you look out for? I would split it really into two: attendance at work and performance in work. So attendance at work, are they always ill? Are they always sick on a Monday morning? Excessive late arrival for duty, missing from place of work, leaving work early, etc., etc. And what about performance? Covering up of own mistakes, difficulty in recalling the same, accidents, deterioration in personal appearance and dress, smell of alcohol or other substances, for instance, cannabis, drowsiness, lethargic, shaking hands, etc., etc. So these are some of the things that you can cover. These are some of the things that your managers and supervisors really should be trained and be competent and confident in spotting. These are the people that are going to be going around talking to employees and should be your first line of defense. Ensure that all managers and supervisors receive the appropriate training to carry out their responsibilities under the policy. You wouldn't just throw a set of keys to a large digger, a JCB, type digger and say, can you go over and dig that hole, please? Many people could probably work it out, go over and dig a hole. But would they do it safely? Would they do it as per your requirements? So ensure you give them the tools that are necessary by giving them education and training to carry out their responsibilities. If you're asking them to do something, make sure they're trained appropriately to do it. So let's talk about testing types, what to consider. There are many different types of testing for drugs. The most, so for alcohol, the most frequently used is breath, using a breathalyzer, and we'll talk about those. Blood testing, quite often when we're talking about legal testing, so if you're stopped roadside by the police, you may be required to provide a sample of blood. But in the workplace, it tends to be oral fluid, urine, sometimes hair, sweat is sometimes used, and there's also new developments in things like fingerprint testing and other areas as well, using breath testing for drugs. Currently, oral fluid, urine and hair are probably the most popular and widely used. So let's talk about the windows of detection. The windows of detection is very important to understanding which is the most appropriate kind of testing for your workplace. And it could be a mixture of a few. But when we talk about the windows of detection, if you look at the graph here on the right-hand side, you'll have a cutoff level, and that cutoff level could be for any drug. But let's say we take a drug, the dose enters, it comes up here. So all this area here would be negative. So it'll be a negative, negative, negative. It gets to the cutoff level and enters this part here, which will be the window of detection. And it enters the body. That's a positive, positive, positive. It peaks and then starts dropping after a single dose, and then it becomes below the cutoff level and becomes negative again. And each type of testing has different windows of detection. Oral fluid and blood tends to be the shortest window of detection, maybe up to 24 hours maximum. Urine testing tends to be the middle, so up to 5 to 7 days following dose. Cannabis is different due to the fact that it's fat soluble, the metabolites. So for chronic users of cannabis, somebody that smoked for many months, many weeks, and smokes maybe 5, 6, 7 plus joints a day, that will remain in their system, in the urine system, for a lot longer. So when you're talking about long-term cannabis use, it could be in the detected in urine for 28, 30 days later. Hair, each centimetre of hair is roughly a month of your life. So if we took a 3 centimetre section of head hair from the scalp upwards, that would be the last 3 months of your life. We can also do testing on body hair, fingernails, etc. So these are the things you need to consider. Also, remember what I was saying, there's 2 parts to any drug test. There's the screening and the confirmation. So are you wanting to do on-site, point of care, instant testing? So pee into a cup gives you the results straight away. Oral fluid, put a swab in the mouth, gives you the results straight away. Or do you just want to send it directly to the lab and let them do the screening? But obviously you don't get an instant result. What are your industry and customer requirements? You might be governed by the oil and gas industry to use a specific kind of test and a specific kind of method. So those are the things you need to consider. Are you going to do self-collection? i.e., are you going to train members of your staff to carry out the testing, or are you going to use a third party, so a third party administrator or a collection agency, for them to do the collection of the samples? Think about the facilities you have available. There's no point in wanting to do urine testing if there's no toilet facilities on site. So these are all things that you need to consider. Then you need to consider testing equipment. What's fit for purpose? So when we look at in the UK or Europe, we'll often have something slightly different from what people may have in the USA, for instance. So drug panels may be different from country to country. You might have more drugs that are prevalent in one country than another. But also a big thing to consider is differences in cutoff levels. So at the very beginning, we mentioned EWDTS, the European Workplace Drug Testing Society. They publish guidelines for screening and confirmation cutoffs that should be utilized and used when testing in Europe. And they're very different from the ones that are issued via SAMHSA, for instance, for USA. So consider those. Make sure you're using something that's fit for purpose, that has a high degree of accuracy, sensitivity, and specificity. Does quality matter to you? It matters to us, it matters to me, but quality normally means a rise in cost. Have you got a budget you need to meet? What about breathalyzers? Breathalyzers will pick up alcohol. We're currently looking at breath tests for drugs, but breathalyzers tend to be used for alcohol. And in the UK, for a legally defensible workplace drug test, you need to be using a UK Home Office approved breathalyzer, something like this one here. There's a couple of others that are also on the list, but you might need to use a US Department of Transport one. So think about your customer, think about the industry, think about what's fit for purpose. And what about environmental impacts and innovations? Consider all those things as they're coming through. So when we're talking about the cutoffs, I was just talking to you then about UK and European and USA. So this really is to just demonstrate the difference. So amphetamines in the USA tend to use twice the cutoff level that we use here in the UK and Europe. Benzos, more. Buprenorphine, more. Barbiturates, more. Cocaine, twice again. Ecstasy, twice again. Ketamine, same. Marijuana, same. Methamphetamines, twice. Methadone, the same. Opiates, massive difference. Massive difference. Phencycline, PCP, the same. And propoxyphene, the same. And these are the cutoff guidelines for urine. But we have a similar issue when you look at oral fluid as well. So think about those. Think about the impact that might have. If you're carrying out testing, often we carry out testing for USA companies in the UK. So we're asked to use the USA cutoff levels. but think about if you're doing testing in the UK or Europe, they may require these lower levels to be followed. One of the other key aspects of any policy and procedures is to look after the people who want help. And that needs to be a consistent approach. It needs to be documented in your policy. It needs to tell people when is support available, how do I access that, when is support suitable versus when is disciplinary action more appropriate. As an employee, I need to know that there's confidentiality. I need to know that if I come forward and ask for help, I'm going to get help and I'm going to get the appropriate help, but it's going to remain in confidence. That help could be through company's occupational health. It could be signposting to specialists. It depends on the level. Assessments may be required. Is this person dependent? Is this person addicted? Are they a social recreational user that just wants assistance to help to quit? There are many third-party resources out there, and it's really important to have those. Can people go and get help themselves? So one of the things I often write on the back end of any policy would be places where people can get information from without coming forward. And that might prompt them to speak to somebody in confidence outside of the company, get some advice, get some help, and then come forward. It's important to realize you will have drug and alcohol users in your workforce. Therefore, how do we deal with it? Don't try and bury your head and say, we don't have anybody. We've dealt with companies in the UK who say, we don't have anybody that uses drugs because everybody's over 40. You cannot use that generalization. Statistics will prove and show, and practical elements will prove and show that you will have people using. Some will be social recreational. Some will be addicted. Some will be dependent. Some will be developing between some of those things. And it's really, really important to support those people. You've invested time, effort, money in training these employees. It's far better to have them come forward and say, I need some help, and for you to give them help than it is for them to have an accident, then have to go through disciplinary and possibly lose their job. And what do we do when we give them help? Well, we give them some compliance testing. We get them to work, back to work as safely as possible. And that might be a length of time. It might be working with their treatment counsellor, might be working with occupational health. It may be taking them off safety critical duties and putting them on non-safety critical duties. But key to their success is compliance. And key to that compliance would be some form of testing. Testing enables them to be able to put their hands up and say, look, I'm drug-free, I'm alcohol-free. I've achieved my target. It also gives them a reason to say no. When people have drugs or alcohol problems, they're still within the same circle of friends. They're still living in the same house, same community, same areas, and temptations will still be there. Drug users hang around with other people who use drugs. So sometimes it's very difficult to say no because of peer pressure. Come on, come on. What you need is a little smoke of this play. What you need is a smoke of this pipe. So it's difficult for them. So for them to say, no, I'm on a treatment program, I don't want to lose my job, it gives them a reason to do it. So it's very, very important and supportive. So that's really the testing, the policy, the procedures, training, education, etc. We're now in a bit of a weird state with COVID-19. And when we look at the considerations we need to think about, what we've seen certainly here in the UK is a spike in alcohol use and drug use. during the times of what we would term as lockdown. When the UK got locked down, people isolated at home. They were not able to go into their workplace, and alcohol and drug use started to increase rapidly. This has been documented in The Lancet in April 2020, and they talked about significant public health crisis. And it's not surprising, really, because COVID-19 has caused a number of issues, including isolation, loneliness, boredom, poor mental health, bereavement, and financial worries, debt, redundancy worries, losing my job. And those 6 things there are major, major triggers to looking for a crutch like drugs or alcohol to help them through an issue. So what else do we need to consider? Should we change the way we test with social distancing? How do we adapt the way we test to ensure that the sample collector, the person doing the collection, and also the donor, the person you're taking the sample from, are socially distanced, are safe, and that we can still carry on maintaining a drug-free and alcohol-free workplace? Should we consider, if you've had lots of people off work for months, with the company closed down, return to work testing? Before everybody comes back in, do some return to work testing. Educate people, tell people, look, we understand that drug and alcohol use might have increased while you've been away. But remember, we have a policy here. Remember, we have procedures here. And part of you coming back to work will involve a drugs or alcohol test. Are you going to increase random testing? So it might be that you increase the frequency, or in 10% per month, increase that to 25%. These are things that you may want to consider. Definitely appropriate PPE, personal protection equipment for collection agents, and increased hygiene standards. So collections might take a little bit longer to do. So bear that in mind when you're allocating resources. What about refresher training and education? Bringing people back. Maybe it's, some videos, some toolbox talks, some education, some posters, some booklets, whatever it might be, but really to refresh people's memory and knowledge for them to come back, and that highlights the risks and highlights the policy and what is expected of them as employees. And include questions about DNA in a return to work questionnaire. Ask people to be honest. Have you increased your drinking? Have you developed any drug use issues while being off work? Do you want to come and see and sit with somebody and have a talk? By asking people and encouraging people and allowing them to say, actually, yes, I could do with having a talk. Engaging with those employees will be far more successful than having an accident further down the line. So that sort of really concludes my whistle-stop tour today. I did promise to show you how to spot a meth lab in your area. So those of you who are interested, that's a brown lab and a golden lab and a black lab. And if you see one like that in your area, that's what we call a meth lab. So thank you very much for listening. I hope it's been engaging. I hope it's been of interest and has covered some of the areas that you might want to know. And I'll hand back to Karen and ask if there's any questions.
Okay. So we have our, apologize here. If everybody has questions, please type them into the chat box. But I do have a couple here, Matt. And one was, would you recommend doing testing in-house or using an external company?
Okay, so there's pros and cons for each, really, Karen. Using your staff in-house means that you can control and manage the situations in a very responsive manner. You can deal with things as they happen, and if budget is something that's key, then it will definitely keep your costs down. It's as long as those people are trained and managed into a confident and competent manner, they can deliver a service which is, you know, can be essential and can be more than appropriate for the needs. However, a lot of people may say, look, I want to keep it at arm's length. I want to keep and remain independent. So choosing a third-party administrator or a third-party collection agency to come in and do that and carry that out is going to be more expensive. And there is going to be a time lag. But those are the things that you must consider as pros and cons for each. And you might even choose a mix. So you might have day-to-day testing, random testing, employee compliance testing carried out by members of staff in-house, whereas response to for cause or with cause or after accidents or incidents, you may wish to call in a third party so that there's an independency there as well. So there are pros and cons for each. I wouldn't recommend one over the other, and some people do actually use a mixture of both. So I hope that answers that question.
Yes. So, and I have another one here. Which is better, oral fluid, urine testing, or hair testing?
Okay, so that is a very frequently asked question. So we go back to one of the slides that I said about the window of detection. Hair testing. Hair testing is not going to tell you if somebody is impaired or under the influence at the current time of testing. It takes roughly a week for the root part of the hair to come out above the scalp. So if I was to snort a line of cocaine in front of you, Karen, I've never taken drugs before, so it's not going to be in my hair, and I snort a line of cocaine in front of you, you've seen me do it. Doing a hair test immediately on me wouldn't prove anything because it would show negative. How long would that cocaine remain detectable in oral fluid and urine is important. So it would take roughly half an hour to become detectable in oral fluid. Roughly about 60 minutes to become detectable in urine. However, it will be out of the oral fluid system in probably 12 hours, depending on the potency, quality, and quantity of the cocaine taken, but roughly 12 hours. And within the urine system, that could be detectable for 2 to 3 days. So it very much depends on what are you trying to prove. So a lot of our customers are now switching across to oral fluid testing because what they wanted to do is decide, is the person under the influence of drugs at this current point in time? I.e., if we take cannabis for a perfect example, if I smoked a joint on a Friday night and I come to work on a Monday morning and I'm a regular user of cannabis, it may well be detectable in my system on Monday and Tuesday. And some may argue that I'm not actually impaired. There are studies that sort of show that impairment is long lasting and therefore cannabis can remain in the system and cause what I would call secondary impairment, i.e. you're not stoned, you're not, under the influence of the cannabis as it stands. However, you may be impaired through sleep deprivation or interruption of sleep, poor health, etc., etc. So those are the things that I would consider. Oral fluid is when you're wanting to look at a very short period window of detection. So roadside testing, for instance, is somebody driving while under the influence? Oral fluid is very much more relevant to blood tests, what's in the blood, than perhaps urine. When you're looking at pre-employment testing, you may want to look at hair, because hair has a much longer window of detection. So are you wanting to know what the person had today, i.e. I've just abstained for a couple of days, come from my pre-employment, passed my test, but I'm a regular drug user? Hair testing will be able to look back months, weeks or months. So, for instance, if I'm selecting an armed police officer, do I want to know, is this person drug-free just for today, or are they drug-free every day over the past 3 months? So these are the things that you need to look at. Each one has its pros and cons. Each one has its, what I would call, position within the drug testing world. And each one has different levels of accuracy, specificity, and sensitivity. So look at what's most appropriate to your industry. Look what's most appropriate to what you want to achieve from the policy. And it could be a mixture of a few. After an accident or incident, is a hair test any good? No. An oral fluid test would be, because it would show you, has this person got the drug in their system probably within the last 12 hours. So hopefully that answers a little bit with that. Would I recommend one over the other? Everything is bespoke to what you're looking at. Just as the policy can never be generic, you should always look at saying what's most appropriate to the situation, what's most appropriate to the industry, what's most appropriate to the guidelines. Okay?
Okay. So we have a question here from Natasha. She says, is rapid testing almost as accurate as lab-based? So what is the difference between the in-house versus the laboratory testing?
Okay, so rapid testing would be what we would call point of care testing or instant test. So pee into the pot, you get a result. Go back to what I was saying about 2 parts of a drug test, screening and confirmation. If we leave the confirmation bit out of it for now, what Natasha's asking is rapid testing screening comparative to laboratory screening? And it's very much dependent on the kit that you're using. Laboratory screening can vary slightly in accuracy, but it's not 100% accurate by any stretch of the imagination, hence why we have confirmation. It also depends how it's screened, so what machines, what methods are being used. The point of care testing, you use a good quality test, and that tends to come with a good quality price tag. You will find that there's not a lot between rapid testing and laboratory screening. Certainly what we've done when we've looked at it, it's very, very similar. And the bonus is, the pros are you get the result. You can deal with the person immediately. Obviously, if you're sending a sample off to a laboratory for screening, it could take 24 hours before you get that result. So what do you do with the person? Do you lay them off work? Do you allow them to carry on work? If you allow them to carry on work, do you allow them to drive home? Do you have to get them home, etc., etc.? So rapid screening, point of care screening, instant screening is very popular because it gives you a tool to be able to take responsible action and be able to manage the risk that's sat in front of you in a manner which is appropriate to the policy. So, in summary, point of care testing, instant testing, rapid screening tends to be slightly less accurate than laboratory, ever so slightly less. But the pros and cons you have to weigh up. You'll also probably find that rapid testing is cheaper than laboratory screening. Either way, if you have a non-negative or a presumed positive on that screen, whether it be in your rapid test or at the laboratory, it then must progress to a confirmation analysis, which can only be done in the laboratory. So many of our customers would choose rapid testing over laboratory screening because the pros far outweigh the cons.
Okay, I'm going to add one little thing to that, and that is in our state in Florida in the U.S., we have a program where employers can participate in this program to get a discount on their workers' compensation insurance premiums. And the regulations that were implemented with that requires the employers to utilize a laboratory. Because that puts the entire chain of custody on a third party with certified collectors and a certified chain of custody and so on and so forth. So that's just an important thing, just to know what's required if you are in a situation where you have some regulatory responsibility. Maybe it's an employer's organization like a union or something like that. There may be requirements that they have that you have to conduct those tests in certain ways. So just be aware of what procedures.
I completely agree. Here in the UK rail industry, we're not allowed to use point of care rapid testing. Everything goes back to the laboratory for screening first and then confirmation analysis. And that's heavily driven by the unions. Heavily driven by regulation. So again, it comes back to what is fit for purpose. Look at the industry, look at your customer, look at what you're trying to achieve. And if it's achievable using either method, then choose the most appropriate method.
Okay. So we have a question here from Christina. Are there situations where you would want to do two types of tests?
Yes. So first of all, I'm assuming Christina doesn't mean drug and alcohol tests. So, for instance, we do a breathalyzer for the alcohol, and then we do a test for the drug. So that would be two types of tests. I'm assuming she means, would you do a urine and an oral fluid, or a urine and a hair, etc. And certainly, there's times when that might be appropriate. So it may be where somebody's saying, look, I've never used before, and it was a one-off, and it could be through legal medical reasons. So where we do a lot of hair testing in the UK and Europe would be child custody cases or child protection cases where we're testing parents to see if they have a long-term drug or alcohol issue. That case, we may do a urine test because that would look back just at the last week or so, and we'd also do a hair test to just see the window of detection a lot longer. When we're talking about the workplace, you would tend to do one or the other. It may be that due to an employee compliance or return back to work, you may want to look a bit further back. So if you generally use oral fluid testing, that's not going to look further back, so you may consider using one of the other methods. You may want to use oral fluid testing as a triage. So, do I need to call somebody in? So, you have some oral fluid tests available. You carry out a test, and if it's negative, is there any point in calling a third party in? Again, is it a regulatory requirement for you to call a third party in no matter what the result? So there could be different areas where you might consider using different tests. However, there tends to be not many times when you would use a urine and an oral fluid at the same time, or a urine and a hair, certainly within workplace. I hope that's answered.
Right. Yes. So you touched on one thing there I wanted to come back to. You talked about, the types of testing, one for drugs and one for alcohol. And I think that's important to mention that if you have a for-cause reason, for example, you suspected someone may be showing some signs that are consistent with being impaired, or if they were in an accident. In those kind of cases, you would want to necessarily do a drug test and an alcohol test, because you don't know if they're under the influence of one or the other or both. So I think that's an important point to just.
Yeah, correct. And if I can just pick up on that, certainly going back to what Christina's question was, when I write a policy, I never specify what type of testing is going to be carried out. It basically would state something along the lines that the company reserves the right to use the most appropriate testing method for the situation involved. And that allows you to keep that fluid. Drug and alcohol testing, absolutely. If you think about a full cause, accident, incident, or if you have suspicion, and hopefully that suspicion will be because you've trained your managers in an appropriate way to be able to spot those signs and symptoms. An alcohol test, absolutely. But you must also consider, and it's something else I need to touch upon, is I would never write in a policy what drugs you're testing for, because you're basically saying to your staff, these are a list of drugs you can't take, but it's okay to take anything else. So again, keeping it fluid by saying, I mean, you might be driven by an industry, you might be told that these are the drugs you test for, but under a full cause post-incident test, if I pass a urine test that tests for 6 drugs, does it mean I'm not under the influence of a drug? No, it just means I'm not under the influence of one of those 6 drugs. So you may like to, consider saying, okay, you've passed that, but we believe there's strong signs and symptoms that you may be under the influence of something. So we're going to send that sample back to the laboratory and ask them to screen for a much larger panel of drugs. So one of the laboratories that we work with can screen sort of 36 different substances all in one pass. And you're never going to get that on a rapid drug test. So, things to consider. Always do a drugs and alcohol test, because many people are polydrug users. And if they're using alcohol, they may be using prescription medication, which in combination compounds the risks involved. And your medical review officer, who may be required to look at the results, may have to consider that this person was using alcohol, but they were also using, for instance, benzodiazepines or an opiate, an opioid, something along those lines. And the mixture of the two can make that person a high risk to the business.
I will say in the US that it is pretty much a standard thing, is that the types of drugs that are going to be tested for are included in the policy. There's kind of two level. We have a 5-panel test, which is 5 at the most common, and then a 10-panel expanded test that has some additional drugs. Yeah. But I would say that in addition to when you're doing a drug test, especially a for cause or a post-accident, that you definitely want to document what led you to that decision to make that drug test. For example, if someone was showing signs, what were those signs that you saw prior to making the decision that this person needed to be tested? And that I recommend in all situations, with the exception, of course, is a random test, because that is something that, is just coming up, and there's not a cause reason for doing that. That's just your company policy. But certainly you wouldn't do it for pre-employment testing, because you wouldn't have a cause in that circumstance either.
Karen, I think you've hit the nail on the head there. Every country is going to be different.
Right.
It's really important to engage with somebody within that country who's au fait and okay with the regulations, what's required. Are you allowed to test for other things? I know certain states within the US have now removed cannabis off their testing panel.
Right, right.
Which to me, as a person within this business, amazes me, because drug and alcohol testing is not about what's legal and illegal. It's about what's safe. And anything that can cause impairment, alcohol is legal. We still test for it.
Right.
So just because cannabis is now legalized, used recreationally or medicinally, why should that be removed from the panel? It's one of the conversations I often have at our international meets. It amazes me. Anything that can impair somebody should be something that's considered when you're looking at a substance abuse policy. But you're exactly right, Karen. Different states may only test for 5 drugs. They might test for 6. One industry might test for 7 or 8, whereas you go to another industry and they test for 10.
Right.
So in the UK, the standard rail industry would be looking at 8 drugs plus alcohol, whereas the London Underground would look at 9 drugs and alcohol. So it's important to get that local knowledge. You know, there's plenty of networks and groups such as yourselves, such as IFDAT, such as EWDTS. The resources to be able to network with global people nowadays are there. The world has become a very small place, so the knowledge to be able to get what you need is out there, and using associations like yourselves and networking with people is really important to make it a successful point.
Well, on that note, I will segue right into, you talked about networking with people, and on our the opening waiting room little video that we had going, we had a slide that talked about the International Society of Substance Use Professionals, and I would like to invite everybody to consider joining that. There's no cost for that. It is a global, not-for-profit, non-governmental organization to support the development of a professional prevention and treatment network. It serves as a focal point for information about substance use, prevention, and treatment. It has a wealth of resources that you literally just don't have time to even look at all of them, but there is a knowledge share. But most importantly, I want to invite you then, once you join the ISEP network, is to join the virtual work group for workplace-based prevention. It's a long, big thing to say. I am one of the moderators for that. And I put up articles throughout the week, every week, of things, just aspects of drug-free workplace programs. I will include this information regarding joining ISEP when I send out the links for the survey. And so I hope that you all that are in prevention, treatment, drug testing industry, or any kind of other organizations that work with folks that work to prevent or treat folks that have substance issues, that you will consider joining this. So thank you so much. Reminder, we'll have another webinar in mid-October, and I'll invite everyone to that. And just be watching for that survey at your email address. So thank you so much, Matt. It was a very informative presentation, and so thanks, and this concludes our webinar.
Thank you for having me, Karen.
Okay, thank you very much.
Thank you. Have a good day, everyone.